Hello, in today's video I'm going to talk about ovulation. Ovulation simply means the fertile period of a woman. Ovulation is part of the woman's menstrual cycle. Remember, it's part of a woman's menstrual cycle. Now, we have both the left ovary and the right ovary, and we have hundreds of thousands of follicles inside this ovary. And now, for ovulation to occur, one follicle must be mature. At first, they all start maturing, but it gets to a stage, about the seventh stage, that others will stop maturing. Just one will continue the journey. Now, let me take you back to what happens. What happens is that the anterior pituitary gland of the brain is going to release a hormone called the luteinizing hormone. It is this luteinizing hormone, a surge in this luteinizing hormone, that will now cause the maturation and release of the dominant, the mature follicle. It will cause it to release the egg or ovum, and this will be released into the abdominal cavity. But before it's released, the fimbriae, which is the ending part of the fallopian tube that has a finger-like structure, will now be there to capture the egg or ovum once it's released. So once it's released into the abdominal cavity, this fimbriae will pick it up and through muscular contraction move it to the center of the fallopian tube. That is where it's going to stay to be fertilized by the male sperm. Now, what is the duration of ovulation? Duration of ovulation is 12 hours to 24 hours. Within this period, that is when it is expected to be fertilized by the male sperm. Now, ovulation occurs on the 14th day after menstruation. How do you count? You count from the first day of your menstruation, the first day of your period, to the 14th day. That's when ovulation is expected to occur. Now, I'm using a typical 28-day cycle of a woman, for example. Okay, so once this egg is released and is there and is fertilized, then implantation, it will now be further expelled to the uterus for implantation to take place. Alright, or embedment to take place. But if it was not fertilized within 24 hours, it will be shed off with other endometrial lining as menstruation on the 28th day. That's when you hear about the weeping uterus, meaning that the uterus fertilization did not take place, so uterus does not have any pregnancy to keep. That's why we call it weeping uterus in midwifery. So the fertilized egg, if it is fertilized, will go to be embedded in the uterus. If it is not fertilized, it will be shed off with other endometrial lining as menses on the 28th day. Now, what are the signs that will show a woman that, oh, I'm menstruating? First, you're going to have abdominal pain, abdominal contraction pain, just like that of menstrual pain or dysmenorrhea, but it differs from person to person. It doesn't happen in every woman. Another thing is that you're going to have a vaginal discharge, a thin egg-like white vagina discharge, that when you put it between two fingers, it draws. Now, this is also the time that the woman will have a strong urge or desire to be with their partner for sexual activity. These are the things that will make you to know, oh, I'm ovulating. So please find your way around it. Observe yourself, observe your cycle, and know when you are ovulating. That is your fertile period. If you find this video helpful, please like, comment, and share. And if you have any question, put it in the comment section. I'll attend to it. Thank you so much and have a lovely day.